लास्ट में बंद कहाँ से करना है? अच्छा एंड, ठीक है। स्टार्ट करें। Hello friends, so welcome to the super revision session of FMG and INI-CET. So let's start the session. See question number 1. The question is, a 75 years old North Indian woman presented to the outpatient clinic with complaints of fever. So this patient is having fever since 1 month, generalized weakness, and there is anterior neck swelling. So swelling is present in the anterior part of neck since 4 years, but rapidly progressing since past 3 to 4 months. There is pain over the swelling, very important finding, and hoarseness of voice. Patient further reported the history of weight loss and decreased appetite. Means there is anorexia and weight loss. So obviously it is suggestive of malignancy. She denied dyspnea, dysphagia, and any history of cancer in the family. Prior medical history was described as non-significant. What is the most probable diagnosis? So if you see the options, it's papillary, follicular, medullary, anaplastic. So you first tell me that what is your answer, and then we will discuss the question. So I'm waiting for your reply. Suhail, Rohan Patel, Aditya Singh, Sharwan Thori, everybody is marking option A. See the question carefully. There is pain over the swelling and simultaneously there is hoarseness of voice. Age of patient, most important, that is 75 years. See the findings. Age of patient, 75 years. There is swelling, thyroid swelling, but there is pain over the swelling and there is hoarseness of voice. And what is the problem? There is sudden increase in the size of swelling. Now tell me the answer. There is sudden increase in size of swelling. Tell me the answer. Yes. Now Yatin, Rohit Pandey, Tahmeen, Krishna, Ghena, Abhay, Arnold, Chota Bheem. Yes. Majority of you are marking D, anaplastic, and some of you are marking follicular as and medullary also. So question is very easy. Let's discuss. First of all, age 75 years. So let me tell you two important malignancies which are seen in 7th to 8th decade. You tell me 70 to 80 years. Yes, malignancies which are seen in this particular age group. One is carcinoma prostate, and the second is anaplastic carcinoma. Clear? It means rest of the malignancies are ruled out. First of all, see what is the age of papillary carcinoma. It is seen in 3rd to 4th decade. Follicular, it is seen in 6th decade. Medullary, generally seen in 6th decade. Anaplastic, 7th to 8th decade. Second, there is sudden increase in the size of swelling in two malignancies. One in follicular, because patient is already having goiter, and the second is anaplastic. In follicular carcinoma, there is no pain over the swelling, or there is mild pain. But there is no evidence of compression like dyspnea, dysphagia and hoarseness of voice. If you see this question, this patient is having hoarseness of voice. Simultaneously, patient is having anorexia and weight loss. So all these findings are suggestive of what? Correct answer D, and that is anaplastic. So anaplastic carcinoma, that is the correct answer, right? How to differentiate it from follicular? Follicular is seen in 6th decade. There is sudden increase in the size of swelling, but there is no pain or mild pain and no evidence of compression. Out of these 4 malignancy, which one is having positive family history? You know, medullary carcinoma is associated with MEN 2A, 2B. So if you see here, there is no any history of cancer in the family, means medullary carcinoma is also ruled out. Got it? So what is the correct answer for this question? The correct answer for this question is D. Okay, in anaplastic carcinoma there is severe pain. So majority of you initially marked option A, but at the end most of you marked the correct answer. Clear? Madara, Raksar, Ritam, Saini, Arthi, Samarth, Pradeep Singh, Madhuri Jadhav, Ruksar, everybody is correct. So correct answer is D, anaplastic. See the second question. 48 years old female came with complaints of headache and blood pressure is raised. So first problem, this patient is having headache and there is high BP. CT revealed a mass in adrenal gland. Okay. So can you correlate? Mass in adrenal means adrenal tumor. There is headache and there is hypertension. The most common clinical sign found in this condition. First, you tell me what is the diagnosis. I'm waiting for your answers. Tell me the diagnosis in this case. Yes, very good. Rishabh, pheochromocytoma. Ashwadhama, pheochromocytoma. Yes. Yours truly, Dr. Divya, Vani. Everybody is correct. It is pheochromocytoma. And you know what's the triad of pheochromocytoma? There is headache, diaphoresis, palpitations. Headache in this diagnosis is pheochromocytoma, and you know it is characterized by headache, diaphoresis and palpitations. Clear? There are 2 questions which are asked frequently. First, what is the most common symptom of pheochromocytoma? And you know the most common symptom, that is headache. The most common symptom, that is headache. But what is the most common sign or most common manifestation? And the most common manifestation is what? Hypertension. So hypertension, that is the most common manifestation. So here the answer is most common clinical sign found in this condition, and that is hypertension. So correct answer is B. Let's see how many of you mark the correct answer. Arnold, Yogesh, Gokul Saha, Chota Bheem. Clear? Ankur Chatterjee, Dr. Alia, Junaid, Hussain Bhatt, your truly Dr. Dikshat, Aishwarya Yadav, Mrinoy, yes, Madhumita Malik, Yadav Ravi, Renuka Beniwal, Amir Suhail, Aarti, yes. So everybody, almost everybody marked the correct answer, and that is hypertension, right? Now see the question number 3. First read the question. 22 years old male presented with repeated episodes of hematemesis. So first finding, this patient is having hematemesis. Second, there is no history of jaundice or liver decompensation, means no jaundice, no hepatic dysfunction. On examination, the significant finding include massive splenomegaly and presence of esophageal varices. There is no ascites or peptic ulceration. Liver function test is also normal, most likely diagnosis. So see, this patient is having what? Hematemesis, first finding, and this patient is having massive splenomegaly. 2 things. These are the 2 things. There is massive splenomegaly. But what you have noticed, that there is no ascites, there is no jaundice, and this patient is having no hepatic dysfunction. You tell me what is the diagnosis? No hepatic dysfunction. This patient is having hematemesis, splenomegaly, which is massive, without any ascites, without any jaundice, without any hepatic dysfunction. Tell me, what is the diagnosis? Yes, Anjana Avasthi, B, non-cirrhotic portal hypertension, Arthi, A, Samarth, A, Sanjay Kumar, B, Shafiq, B. Yes, very good. So majority of you are confused between option A and B, right? See, whenever there is hematemesis and splenomegaly without ascites, jaundice, encephalopathy, it means there is non-cirrhotic portal hypertension. So what is the diagnosis? It is non-cirrhotic portal hypertension. And in non-cirrhotic portal hypertension, two things are there: extra hepatic portal venous obstruction and non-cirrhotic portal fibrosis. Clear? In both, there is hematemesis, there is splenomegaly without ascites, without jaundice, without encephalopathy. But in cases of EHPVO, there is mild to moderate splenomegaly. But in cases of NCPF, moderate to massive splenomegaly. So this massive splenomegaly points towards what? NCPF, non-cirrhotic portal fibrosis. So what is the correct answer? This is option number B. Yes, non-cirrhotic portal fibrosis, right? Let's see how many of you mark the correct answer. Priya Bhanu, Alia, Chota Bhim, Vikas Raj, Gokul Saha, Arthi, Utkarsh Sinha, Priya Bhanu. All of you. Yes, Levin Kumar, Ritam marked, Chandrababu, Aswadhama, Adil Mobin, Anjali, Musk Stock Trader, KP Nirmala, Shahnawaz, Kalpesh, Dikshat. Yes, all of you. Initially, you people were marking option number A, but since there is massive splenomegaly, it is non-cirrhotic portal fibrosis. Let me repeat again. Whenever there is hematemesis and splenomegaly without ascites, without jaundice, without encephalopathy, means the diagnosis is non-cirrhotic portal hypertension, and massive splenomegaly is seen in non-cirrhotic portal fibrosis. Correct answer is B. See this question. A 40-year-old female, known case of proximal cholangiocarcinoma, she was having cholangiocarcinoma, underwent, see, PTBD, percutaneous transhepatic biliary drainage. Percutaneously it's done. And the patient bilirubin level was very high. She was having jaundice. After the procedure, the patient developed, can you see, abdominal pain. On further evaluation, patient was found to have hemophilia. Why? Due to iatrogenic trauma to the biliary tree. Which of the following statement about hemophilia are true? So first you tell me, hemophilia, what is the most common cause? And it is iatrogenic. Means it is caused by percutaneous transhepatic cholangiography. That's the most common cause. You know, it is characterized by a triad. Which triad? Quink's triad. It is characterized by Quink's triad, which is also known as Sandblom's triad. Quink's triad or Sandblom's triad. What are the components of Quink's triad or Sandblom's triad? There is clot colic, means pain. There is jaundice, and there is GI bleeding. This GI bleeding can be upper or lower. Upper GI bleeding means hematemesis, lower GI bleeding means melena, and the most common manifestation is melena. Clear? In these cases, the first investigation done is endoscopy. Why? Because there is bleeding. Since the bleeding is there and the bleeding is arterial, what kind of bleeding? The source of bleeding, it's arterial, and that's why what is the investigation of choice? That is angiography. Investigation of choice is angiography. Clear? So these are the basics. Now you tell me what is the correct answer. I'm waiting for your reply. Let me see. Chota Bhim, Aarti, Madhuri, Nasreen, Anjana Avasthi, Gehna, Pradeep Singh, Dr. Beardo, Zameen Zahur, Manoj Patil, Dr. Aswadhama, Ashu, Adil Mobin, Sneha, Rocky, Senthil, everybody is marking C, and that is the correct answer. Let's discuss one by one. Tumors are the most common cause. No, it is iatrogenic, means percutaneous transhepatic cholangiography. Primary treatment of severe hemophilia is surgery. No, because there is bleeding. So we can go for angiography plus embolization. You can go for angiography plus embolization. Why? Because the source of bleeding is arterial. Classic triad is upper abdominal pain, GI hemorrhage and jaundice. That's correct. This is the Quink's triad or Sandblom's triad. Ultrasonography reveals specific diagnosis. No, it's the angiography. So correct answer for this question is option number C. Clear? So majority of you marked the correct answer. Now see this question. Liver recipient was 47 years old male. 47 years. His blood type was the same blood group of the donor. Weight 54 kg. Height 1.65 meter tall. BMI 19.8. Diagnosed with hepatitis B virus induced HCC. There is cirrhosis, HCC. Now how many tumors? 2 tumors less than equal to 3 centimeter in size. There are 2 tumors less than 3 centimeter in size, less than 3 or equal to, without extrahepatic or major vessel involvement, means no extrahepatic or vascular spread. There is no extrahepatic or vascular spread. MELD score was 18. Child Turcot Pug or CPT classification was B7. Criteria used to determine whether patient with HCC can move forward with liver transplantation or not. So you know there is a criteria for liver transplantation used for patients of HCC. You tell me the name of criteria first and then I will discuss. I'm waiting for your reply. Sanjay, Noman, Kajal, DS, Rohan Patel, Aswadhama, Chota Bhim, Ashu, Paras, Shahnawaz, Aanchal Garg, Adil Mobin, Supriya, Akshay Gandhi, Renuka Beniwal, Manoj Patil, Sanjay Kumar, Samay Patel, Nasreen Khan, Kalpesh, Wani, Anjana Avasthi, Shrestha, Ashu, Shah Amir, Vivek Yadav, KP Nirmala, Madhuri Anand Jadhav. Yes, majority of you are correct. This is Milan's criteria. So what's the name of this criteria? Milan's criteria. And what are the components of Milan's criteria? First, liver transplantation should be done in patients who are having HCC if there is single tumor. There is single tumor less than 5 centimeter. If there are multiple tumors, number should be 2 to 3, size should be less than equal to 3, and there should not be any extrahepatic or vascular spread, means no extrahepatic or vascular spread. Clear? So this is Milan's criteria, and what is the correct answer for this question? B. B is the correct, and majority of you mark the correct answer. Very good. Now see the next question. It means your preparation is good, is going on. Keep the preparation by this pace only. Keep studying. Now see this question. Chronic alcoholic, first pointer. Chronic alcoholic patient presented to emergency with severe pain in epigastrium, and there is severe pain in epigastrium and multiple episodes of vomiting. On examination, there is guarding in upper abdomen, upper epigastrium. Chest x-ray was normal. If chest x-ray is normal, it means there is no perforation. No perforation. Okay? Perforation is ruled out. Second problem, since there is vomiting only and in vomitus blood is not mentioned, means there is no hematemesis. Clear? So if there is no hematemesis, then there is no Mallory we steer. You know, there is Mallory we steer, but this Mallory we steer in alcoholic patient, this is painless. It is painless, And because of bleeding, in 20% cases, there is severe bleeding that can lead to hematemesis. But problem, it's painful, so it is also ruled out. It means for Mallory-Weiss tear, we perform endoscopy, no need to do that. Alcohol breath test, not required at this stage because you have to make the diagnosis. So patient is chronic alcoholic, pain in epigastrium, clear, and there is vomiting because of paralytic ileus, and there is guarding. First, you tell me what is the diagnosis. I'm waiting. Diagnosis. Very good, Aditya. Aditya Singh, first person who marked the correct answer, acute pancreatitis. Very good. So this is acute pancreatitis. Chronic alcoholic patient having acute pancreatitis. What is the manifestation of acute pancreatitis? Pain in epigastrium, radiating to left side of back, partially relieved by sitting and bending forward. Second, in acute pancreatitis, there is ileus, paralytic ileus. That's why patient is having abdominal distension and nausea and vomiting. Got it? So how we are going to make the diagnosis easily? Serum lipase. So what is the question? Next best step, you have to make the diagnosis by serum lipase. And if the question is asked like this, investigation of choice in acute pancreatitis, then it is CCT. Usually we make the diagnosis by clinical findings plus laboratory investigation. We send the investigation for amylase and lipase, but CT can make the diagnosis of complications, generally done after 3 days or after 72 hours. So CCT is investigation of choice. Correct answer for this question will be what? Option number B, that is lipase. And see, majority of you have marked the correct answer. Majority. Most of you marked lipase, and that's correct answer. Gokul Saha, very good. Anjana Avasthi, Ankit, Hitesh Yadav, all of you, yes, marked lipase, that's correct. See next question. Yes, in patient with recurrent abdominal pain, ultrasound was done and it was normal. Ultrasound was done and it was normal. On further evaluation by other investigation, he was found to have biliary dyskinesia. Which of the following is not done for the diagnosis of biliary dyskinesia? Let me tell you, sometimes answers are hidden in the question itself. Tell me the answer. Answer is hidden in the question itself. You tell me the answer. I already told you, answer is hidden in the question itself. Yes. Shrestha, very good. Dhananjay. Yes, Divya. Chota Bhim. Rishabh Yadav, very good. Majority of you marking ultrasound, that's correct. It's written that ultrasound was done and it was normal. Clear? So what is the problem? Ultrasound is not done usually in the patients of biliary dyskinesia, because you will not get anything significant on ultrasound. By the way, what is biliary dyskinesia? Clear? So this is the umbrella of disorders in which the diseases are affecting the normal motility of gallbladder and sphincter of Oddi dysfunction. So in this, the normal motility of gallbladder and sphincter of Oddi dysfunction is included. That's why what's the name? Biliary dyskinesia. Clear? Now, which investigations are done basically? In biliary dyskinesia, we perform CT or MRCP. And what you are going to find on CT and MRCP? Dilatation. Dilatation of what? Bile duct or pancreatic duct. Simple. Second is, HIDA scan will show you delayed biliary transit. Clear? So if there is HIDA scan, we are going to do, in that case, there is delayed biliary transit. Clear? And what is the gold standard investigation for diagnosis? That is ERCP with manometry of biliary and pancreatic sphincters. So ERCP plus manometry of biliary and pancreatic sphincters. Pancreatic sphincters. This is the gold standard. ERCP plus manometry of pancreatic and biliary sphincters. This is the gold standard. And in post-surgery follow-up also we are going to do the follow-up, and we are going to assess whether patient is going to improve or not. So if patient improves after sphincterotomy, what happens? It is suggestive of biliary dyskinesia. Got it? So why we perform HIDA scan? Because there is decreased biliary transit. ERCP plus manometry of biliary and pancreatic sphincters, it's a gold standard. Post-surgery follow-up, patient will improve after sphincterotomy. Ultrasound is usually not done. So what is the correct answer for this question? It is option number D, ultrasound. And let's see how many of you marked correct answer. Yes, Marcel, very good. Marcel, you are correct. Vikas Raj, you are correct. Aditya Sharma, Potter, Priya Patel, Jack, Dr. Vikram, Aswadhama, Shrestha Sharda, all of you are correct. All of you, Utkarsh Sinha, Ishan Jain, DD Delhi, Jishan Khan, Shinjit Mani, Pooja Yadav, Mehul Dhamelia, Vani, Shahnawaz, all of you are marking correct answer. All of you. Very nice. Clear? So correct answer for this is option number D. Let me tell you, sometimes answers are hidden in the question itself. So if you read the question, ultrasound was done and it was normal. So correct answer is option number D. Tell me this question, it's very easy. Many times it was asked in pediatrics, in surgery, as well as in radiology. See, newborn infant presented with, important finding, abdominal distension, vomiting and not passing meconium for 48 hours. Now see the problem. The patient is having abdominal distension, the patient is having vomiting, non-passage of meconium. Patient was further investigated and taken up for surgery. Duhamel procedure. And you must be knowing that Swenson, Duhamel, Sowe. Swenson, Duhamel, Sowe. These are the surgeries which are done for which condition? You tell me the correct answer. I'm waiting for reply. Tell me, all of you. Yes, very good. Rohit, Shiv, DS, Kajal, Anita, Divya Shri, Patel, Mehul, everybody is correct. Hulk is also correct. Ishan Jain, Vani Shahnawaz, Utkarsh Sinha, Samay Patel, Pooja Yadav, Yash, Pradeep Singh, Dr. Alia, DD Delhi, Shinjit Mani, DS, very good. Divya, all of you, Saini Sahab, Avinash, Faiz, Malik Yadav, Rekha Meena, Aarti, Rohit, Rohan, Manoj, Rohan Doshi, Jack, all of you are marking option number A, that is Hirschsprung's disease. And you know, this is absence of, characterized by absence of ganglion cells. And what is the problem? The affected segment is contracted. So if the affected segment is contracted, these patients are having signs and symptoms of large bowel obstruction. Why? Because most common site is rectum followed by sigmoid. Clear? So what are the findings? These patients are having abdominal distension, there can be vomiting and non-passage of meconium, Hirschsprung's disease. And you know how we make the diagnosis? Rectal biopsy, and the treatment of choice is Swenson, Duhamel or Sowe operation. So correct answer for this question is A. Read this question and tell me the correct answer. 28 years old male came to the OPD with complaints of abdominal pain and abdominal distension. Abdominal pain and abdominal distension. There is history of road traffic accident, and see, blunt injury to abdomen. Physical examination revealed positive Keher sign. Keher sign. You tell me first, what is the most commonly injured organ in blunt trauma abdomen? I'm waiting for your reply. Most commonly injured organ in blunt trauma abdomen. Tell me, all of you. Very good. The first person is Avinash. Splenic injury. Very good. Shivam Tyagi. Yes. Malvika Krishnam. Very good. Everybody is marking the correct answer. Spleen. Clear? And you know that whenever there is splenic trauma, there is collection of blood. Under the collection of blood, under this left dome of diaphragm, it is going to irritate phrenic nerve. And because of phrenic nerve irritation, there is referred pain to left shoulder. So referred pain to left shoulder because of irritation of under surface of diaphragm. Why? Because there is collection of blood because of splenic trauma. This is Keher sign. So correct answer for this question is option number A. That is splenic injury. Let's see how many of you mark the correct answer. Prince, Arnold, DS, Sneha Kumari, Harsh Chaudhary, Anjana Avasthi, Madhumita, Shafiq, Divya, Manoj Patil, Aswathama, Alia, all of you are marking the correct answer. Kajal Parmar, Aditya Singh, Rohit Raj. Yes, all of you are marking the correct answer. Clear? So correct answer for this is A, option number A, splenic injury. Now see this question. 60 years old chronic smoker presented with painless jaundice, pruritus and clay colored stools for 2 months. Clear? History of waxing and waning of jaundice was present. CT scan revealed dilated main pancreatic duct and common bile duct. What is the likely diagnosis? So see, painless progressive jaundice is the classical feature of cholangiocarcinoma, but it is also seen in carcinoma pancreas, right? So it is seen in carcinoma pancreas, but certain patients in whom there is, you can see this, certain patients in whom the malignancy is here, where in the ampullary carcinoma, what happens? In these patients, every 2 to 3 months, there is sloughing of the growth. And if sloughing of growth occurs, what happens? Partially the jaundice is relieved. So waxing and waning of jaundice is typically seen in ampullary carcinoma, which is the part of periampullary carcinoma. Clear? So what is the likely diagnosis? Obviously, the option number B. What? This is periampullary carcinoma. That's the correct answer. So let's see how many of you mark the correct answer in this question. Praveen Kumar, Pradeep Singh, Lahita, Gujjar, Ishan Jain, Metamorphosis, Dhruv, Ganavel, Amir, Pooja Yadav, Avinash, Kajal Parmar, Shivam Tyagi, Savitri, Rani Pandey, Manoj Patil, Ira Katkar, Dhananjay Sharma, Edison Singh, Priya Agarwal. Majority of you are marking what? Correct answer, periampullary carcinoma. Let me tell you, some of you are confused. In carcinoma head of pancreas, there is jaundice, but waxing and waning of jaundice is not seen. This waxing and waning of jaundice is typically seen in ampullary carcinoma, which is the part of periampullary carcinoma. So correct answer for this question is option number B. Option number B. Clear? So these were the important questions. These were the important topics which are frequently asked in INI-CET, NEET PG, FMG. So I hope all of you enjoyed the session. Good luck for your preparation. Keep studying, keep working hard. Definitely you are going to crack this exam. Best of luck to all of you and happy Diwali in advance.